that actually our group had a very good productive discussion. So of this discussion, because of this time factor, I quickly go through that. We have identified challenges and then from our these SMP, and then some of these things from the discussion also. Then we find out the solutions for the challenges. So, but it's still that we need to discuss today to fill up this timeline outcome, and then we are able to identify these people responsible for this each and every solutions. Then the first thing is support is needed to develop these three very different yet connected areas of healthcare. So then the connecting people, particularly I think that web portal can help us. So then second one, the phase 2 of the disability identification model project, full spectrum of disabilities, barriers to the participation and living the best life. So then getting the provide support and the feedback from the people that those who are getting the services. So then third one, the health professionals and other providing health care. And already in the presentation we highlighted there are services start ongoing and then recently started, but these people are without proper training. So then, so care training modules that we have to develop. So then develop a trainer program, and also there are programs through this webnet, and then creating the online forums, and we have identified. And also some of the things we thought that the issue of this volunteerism, and then maybe that get young people, at least when we train 200 people, then out of 200 then we may get 2 or 3 good volunteers to work, and then we can expand the people join with our group. So again, the health professionals, that initially that one for the community, and then for the health professionals at primary care. Then the materials, particularly when they want to get anything about this care, all these things are in English, and then translate that into the Tamil. So there are materials available, and also there are materials translated in Canada, and then those materials could be for this community, but you can adapt those materials. Then the mobile teams, at least now one mobile team in Kilnochi, another one Mullaitivu, and another one in Vietnam, but they are covering more than 200 patients. So then we need to know whether they can provide good services and their service capacity and all. So then we need to expand more and more mobile clinics. So then we have to find out the possibilities of expansion of mobile clinics. And then limited resources and research on disability issues, particularly their needs and sociological aspects, and then anthropological kind of way that what the disability people's rights and their issues. So we want to connect these organizations, particularly international organizations like Spinal Cord Injury Association, like that. And then there are organizations, Disability Rights Promotion International and all, so connecting those organizations. Then, so there is not enough healthcare practitioners to fill vacancies. This we thought to actually work with the university, and before enter the university that discuss with the students to get into this career, and also that human resource. Also today morning they had the discussion, so maybe then we can work with the human resource also. So then, so we also want to set up this partnership with the universities and high schools, North and East, building so volunteer programs. So then we can make the people those who are interested to work in the volunteer program, and also this employment for the differently able people. Then we may need to seek funding in CADs and training to optimize the skill. So then we have to let the people support to find out the funding, and then also the connecting this Ministry of Health and other people to advocacy for more allocating funds. And also we have the problem of this coordinating all the disability and other care providing agencies. So we have to find out maybe that one center of excellence to coordinate all the organizations to work together. Shortage of resources and funding, we want to particularly for this identify and develop funding opportunities. There are terminology issues, even then disability and rehabilitation, palliative, and we had a long discussion because defining these areas very difficult. But that depends on this funding, depends on the terminology what we use. So earlier people were using differently able people, now they have changed to differently disabled people. But then when we had the discussion with the differently able organization, disability organization, they wanted to have a differently able thing. But then when you want to apply for the funding, and we have to say that for the disability. So this kind of thing. And then English language barrier. We are here talking about particularly for the healthcare staffs working in this disability and then rehabilitation and things. They need to be provided the field-related English teaching because that will build the capacity. So then finally, the development of holistic palliative care center. So we have to provide this cultural, spiritual, and personal needs and meet that. So these are the challenges identified and the solution. Now, today we plan to define the timeline. And first we have to prioritize all these challenges. First 4 or 5 to implement within a year or 2. So then. Second thing is timeline and what are the outcomes. So already allocated people to work in this group, and we are planning to invite more people to work in this group internationally. Then we can expand it further. Thank you very much.
Thank you. Next we'll hear from Human Resource Development.
Krishna's able this afternoon, right? All right. Sorry, I'll just go through it from my computer. Good morning. So I think we started the day quite interesting yesterday. Can you hear me now? Right. So we had 13 short-term goals and 7 intermediate goals and 2 long-term goals. So we cut that down to 6 action items. So I was just rearranging my orders. I think action item 1, we felt lack of access to specialized services. The first one we put is we thought we wanted to have some quick and meaningful success. So it's good for us as a group. So the solution we had for that is to set up a telepathology services for the Jaffna Teaching Hospital, and we have been working on that already, and we have the stakeholders highlighted, the people involved in that, so we have put a formal document through it. Our timeline for that is about 3 to 6 months, and I think funding agencies already, IMHO, US has committed to it, so they will work with the stakeholders on that. Then action item 2 we have is lack of employee satisfaction and team spirit. We felt, happens across all the departments and ministries. So the solution for that is we felt we're going to provide capacity building and leadership training and workshop opportunities. And that's going to be taken over by Greg Bewey from Visions Program, who's with us, and Greg has worked with us for many years with IMHO, as well as he's now one of the co-founders of one of the Visions programs out of California. So they said they will, the timeline for this about before June of 2017 to hold a workshop in Northern Province, and the plan is to repeat one in the Eastern Province, and the Visions will come up with his own budget to address that. Action step 3 is the challenge is the shortage of human resources in rural areas, and need to provide, essentially the way to address that is to provide incentive allowances in short term to address that. So we're already doing that with them. A lot of you from the PDH's office know that we provide pre-interns some incentive allowances to work in Delft and some of the rural communities, even in Bani, to go in. But now we have to probably think about expanding that to other healthcare needs, maybe even nursing or even education. So I think we're going to continue this incentive allowance model that we are doing. We need to talk to the stakeholders, both in the health and education ministry, on how we're going to expand that. So that's what addressing the long-term plan we have listed here is telemedicine for address the healthcare needs in the rural community. But I think that's going to be a long-term project. It's going to take time. So just kind of part B. Action 4 is lack of knowledge and career opportunities among healthcare in the healthcare sector in the schools. So this morning at 7 o'clock, there's a great thing about having meetings and workshops like this. We're able to bring Minister Gurugula Raja and Secretary Ravindran, and so that we're able to bring the health and the education stakeholders together and have a quick 40-45 minutes meeting this morning with Eder was there to how we can collaborate, trying to break these silos. Now we can collaborate, and we had some good ideas. We have not consolidated how we're going to go about doing it, but at least we had the appropriate stakeholders around the table, and there are diaspora organizations committing to education as much as to healthcare now, because they believe it's hard to improve the healthcare workforce without addressing the educational needs at a secondary school level. So I think the discussions going on with the health ministry, with the education ministry, how they can work hand in hand with diaspora organizations. Action item number 5, lack of science and English education. We discussed that again, and at the moment, a lot of us are working with SJC 87 group, the Kunoch Education Trust, and now it needs to bring the education ministry into the picture and see how we can help build the coalition to help improve science and English education at high school. So that's our action item 5, and the last one we have is the challenge is to determining the realistic norms to develop health sector cadres, as we highlighted yesterday. So that's going to be, we need to perform a need assessment study, and this is going to be a long-term project. We put 2 years down on the timeline for this. So for this, we're going to, I think Norway hopefully has some funds, THO Norway, I think, and with Malawi being here, she's going to be working with IMHO and other stakeholders to see how we can do in Northern Province and the Eastern Province as well. Study to identify true healthcare cadre strength needed to address the population needs. That's all we have for 6 agenda items.
That's good. So we have 2 minutes if there's 2 quick questions.
Dr. Muruganandan, would add something to it? Oh.
I have only one comment.
Yes, sir.
That regarding this career guidance, to make it make the paramedical or other type of courses popular. I think Jaffna Medical Faculty is planning to conduct an exhibition in June, April. Surenthirakumaran is once again the president there.
Okay.
So we have identified 6 sort of areas, and one of the areas is promote career guidance, because we are expecting 100,000 how could I say, 100,000 of A-level students to go through the exhibition.
Okay,
Can do something quickly as a start, and then we can.
that's great.
We had a discussion, especially then with Surenthirakumaran.
Okay,
We have a committee also for this, including sustainability and this extra from the healthcare side.
Okay.
Working on it, and then we can. We also already started to work with the education to get there.
so there's more to healthcare career guidance than being a physician.
I think there is something missing in these health issues because I have my personal experience. There are some people who are short of kidneys, and they say that we have to spend about ₹1 million or something like to get a kidney back. So have you all thought of that? The other one is cancer. That's very common now, and sometimes to replace blood and things like that. For those facilities also, have you thought of that? And what are the type of diseases which are very common in the northern province? Because I heard during the rainy time, there are a lot of diseases that go unchecked, and whether and rain is very common. So whether you will have thought of some plan to
Address those.
yeah.
Thanks. I'll reach out to you after this. Yes, sir.
Sorry, we're out of time. Sorry,
No, we're out of time. Otherwise, we will not get through everything. So very, very quickly on that, the ministry has 16 high priority areas, and for this meeting, they've chosen 5. So those are all important issues, and those will come up at subsequent discussions. Next, we'll hear from Health Informatics. Just as we transition, 2 quick points. On the incentive allowance, just to make sure that that's checked with the MOH, that they're fine with those incentive allowance expansions. Then as you go through the next steps document, make sure that you try to do an estimate for the people served as well, so that that's filled out. As we go and look for funding, that's going to be an important piece. Then if Juanita or if anybody from the education team is around, we want to make sure that there's some kind of education diaspora group, like there's just ECTMA and IMHO also.